afternoon, everybody. Thank you for being here. I'd like to acknowledge Commissioner Frank Aguilar, in whose district we're located, Commissioner Alma Anaya, who's head of our Health Committee, Vice Chair of our Health Committee, Dr. Kiran Joshi, who's Chief Operating Officer and head of our Cook County Department of Public Health, Dr. Tom Nutter, who's Chief Behavioral Health Officer for Cook County Health, Elsie Salamanca, who is Community Impact Manager for Corazon Community Services, and Denise Holman, Public Health Educator, Cook County Department of Public Health. Thank you all for joining us. We're very grateful. Today we come together to confront one of the most pressing public health challenges of our time, the opioid crisis. Far too many lives have been cut short by overdoses. Far too many families and communities have been devastated. The Get Naloxone campaign is about solutions. It's about making sure every resident knows that naloxone is safe, easy to use, and free, and that it can save a life in a matter of moments. Through billboards, digital outreach, and community partnerships that we will host free, we are ensuring that information and access reaches people and places that need it most. This campaign is more than about education, though. It's about equity. We know that African American and Latino communities bear a disproportionate burden in opioid deaths. It's important to recognize that while people of all races, ages, and economic positions can experience substance use disorder, Black and Latino communities shoulder a higher burden of illness and deaths overall. This is largely due to inequitable investments in education, economic development, and infrastructure, as well as exposure to generational violence and trauma. By working with local businesses and community organizations, we're breaking down barriers and bringing life-saving resources directly into neighborhoods. Cook County has invested more than $20 million in prevention treatment and harm reduction throughout Cook County. This includes distributing tens of thousands of naloxone kits and safe user supplies, training thousands of residents, and building a stronger network of partners to support those struggling with addiction. Our message is simple. Overdoses are preventable. Lives can be saved. And every resident deserves access to tools and support they need. With the commitment of our health department, our community partners, such as Corazon Community Services, and the investment of county resources, we're building a healthier, safer, and more equitable Cook County. Now, I'd like to bring to the podium Commissioner Frank Aguilar, and again, we're in his district. And then I would ask each person to introduce the speaker who follows. Thank you. Commissioner Aguilar.
Thank you, Madam President, and welcome to Cicero. This is my hometown. I'm Frank Aguilar, Commissioner of the 16th District. I'd like to begin to thank Cook County President Tony Preckwinkle, Cook County Department of Public Health, Chief Operating Officer Dr. Kiran Joshi, Chief Behavior Officer at Cook County Health, Dr. Tom Nutter, and Denise Holman with the Public Health for their leadership on this issue and their presence here today. I would also like to thank Corazon Community Services Executive Director Vanessa Melgoza for hosting us today, with a special thanks to our Community Impact Manager Elsie Salamanca, who you hear from her shortly. When I think about this issue, I think about two pillars. We must address this. Resources such as naloxone and the general destigmatization of those who are suffering from substance abuse, and there's no shame of it. Naloxone is an effective, inexpensive, and easy way to use. It's a saving resource. While we are fortunate to have this in our disposal, we must be very public about its availability for all the residents in Cook County and understand that this resource is easily obtainable. We need to encourage everybody, local businesses, organizations, to carry naloxone, and also let our residents know that this is accessible to the communities and no questions asked. Naloxone is available to all our residents with no hoops and jumps and prescriptions needed. Since we launched this campaign early last month, I've seen this information throughout Cook County and in my district advertised. and we will continue to partner with local businesses, organizations, and stakeholders to reach as many people as we can, reducing the overdoses, encouraging safe habits, and most importantly, saving life. Everybody gets affected by opioids and overdose, indirectly or directly. And unfortunately, my family has been affected directly. It leaves such a horrible void. My nephew was a victim to it. And when I spent his last 6 months of his life, I learned so much about addiction. He described it as a medical issue. He needed, like a diabetic needs insulin to survive, or a heart patient needs pills to help his heart. He could not function without it, but unfortunate that opioids eventually would destroy you. He was alone one night when he passed away, and if someone would have been there with naloxone, he probably would have been here with us today. My office will continue to work with local leadership to make sure everyone who needs these resources has access to it. Now I'd like to introduce my colleague on the board, Vice Chairman of Public Health, Almanaya of the 7th District. Thank you.
Good afternoon, everyone. My name is Almanaya, and I have the honor of serving the Cook County District number 7. So it's our neighboring district here in the southwest side of the city of Chicago. I'm also honored to be serving as the Vice Chair of the Health and Hospitals Committee, where I advocate for residents to gain greater access to our healthcare system. Today we gather to reaffirm our commitment that we must do everything in our power to save lives. I am proud of the Cook County Department of Public Health's commitment to invest in life-saving naloxone, also known as Narcan, which can reverse the opioid overdoses. By investing in naloxone and in these life-saving measures, we are urging the general public that solutions do exist that are safe, easy to use, and free for anyone that needs them. In 2024, Cook County recorded over 1,000 opioid overdose deaths. Overdose deaths are preventable, and the campaign launched this month is one small reminder that our loved ones are worth the investment. I am grateful that we are starting this campaign launch here in Cicero, given that Latino and Black men are at most risk of overdosing. For this reason, Cook County is investing in culturally tailored outreach and has partnered with community-based organizations to help overcome these stigmas and barriers. And let me just highlight how important it is that we are partnering up in community organizations here locally. People don't have to go to Cook County Hospital, Stroger. They don't need to go to all of these other areas. The importance of having the expediency of being able to access this in your community is crucial in saving lives, and that's why we celebrate this campaign, and that's why we push for it. I'm very proud that these investments are bilingual education campaigns, and they're utilizing graphics, videos, and partnerships with Latino serving institutions like Corazon today. Anyone can carry naloxone. Today is a reminder that we all play a very important role in saving lives. Thank you, and I'll make some remarks in Spanish. Buenas tardes, mi nombre es Almanaya y es un honor para mí servir como la comisionada del condado de Cook del 7º distrito, representando el suroeste de la ciudad de Chicago. También tengo el honor de servir como vicepresidenta del Comité de Salud y Hospitales del condado. Hoy nos reunimos para afirmar nuestro compromiso de hacer todo lo posible para salvar vidas. Estoy orgullosa del compromiso del Departamento de Salud Pública en invertir en naloxone, o como se conoce Narcan. Naloxone salva vidas y puede revertir los sobredosis de opioides. Al invertir en este medicamento que está disponible en las comunidades, instalamos al público que existen soluciones que son seguras, son fáciles de usar y gratuitas a cualquier persona que las necesite. En el 2024, en el condado de Cook, registró más de 1,000 muertes por sobredosis. Las muertes por sobredosis pueden ser prevenidas. Voy a repetir eso, pueden ser prevenidas. Y esta campaña que estamos lanzando hoy día es un pequeño recordatorio de lo que debemos invertir en nuestros seres queridos y en nuestras comunidades que lo necesiten. Comenzar esta campaña aquí en Cícero es una decisión estratégica porque específicamente los hombres latinos y afroamericanos tienen mayores riesgos de sufrir una sobredosis. Por esta razón, el condado de Cook está trabajando con las organizaciones comunitarias para ayudarla a superar los estigmas que existen y las barreras. Cualquier persona puede llevar Naloxone y es algo que, como mencioné anterior, es fácil y hoy es un recordatorio que todos podemos desempeñar un papel y tenemos que poner nuestro granito de arena para salvar vidas. Muchas gracias. And next, I'd like to welcome Dr. Kiran Joshi, Chief Operating Officer for the Department of Public Health.
Good afternoon. I'm Kiran Joshi, Chief Operating Officer at the Cook County Department of Public Health. Thank you, Madam President, Commissioners, and of course our hosts this afternoon, Corazon Community Services, as well as our partners that are here this afternoon. Having naloxone within reach can mean the difference between life and death during an opioid overdose. The Get Naloxone initiative is designed to make it easy for anyone to pick up free naloxone. No prescription required, no barriers, no questions asked. In the decade between 2013 and 2023, we saw an overall trend of increasing number of deaths from opioid overdoses. Deaths from opioid overdose in suburban Cook County nearly doubled, rising sharply and peaking at 680 deaths in 2022. In 2023, we saw a decline to 450 deaths, and thankfully preliminary data for 2024 show 276 deaths, representing another decline, though we must acknowledge that each of these deaths is a tremendous loss to families and to communities. The progress that we've made is thanks in large part to ongoing public health interventions that are proven to save lives. Education campaigns like Get Naloxone, outreach through organizations just like this one, harm reduction, including needle and syringe exchange programs, and medication for the treatment of opioid use disorder. It is absolutely critical, let me say this again, it's absolutely critical that the progress that we have made is sustained. And so today, we're proud to launch the Get Naloxone campaign. This campaign will be running from August 4th through the end of October. We focused in the areas hardest hit by opioid overdoses in suburban Cook County, and you will be seeing Get Naloxone ads at PACE bus shelters, on community billboards, about 100 retail locations like barbershops, gas stations, the list goes on, and of course, on the internet and social media. Each one of those ads will include a link or a QR code that will take you to a map of locations where you can obtain naloxone and a video on how to use it. Today, there are more than 30 sites across suburban Cook County hosting a box, and that number is slated to grow every week. As always, this program is data-driven. I'm pleased to also announce a new opioid data dashboard with information stratified by a number of different measures for deaths, for hospitalizations, and this all helps us prioritize our intervention, again, focusing on those who are at highest risk. So what is our goal here? Naloxone should be as common in homes and businesses throughout the community as fire extinguishers, first aid kits, or AEDs. Everyone should have it, and everyone should feel empowered using it when needed. Everyone knows stop, drop, and roll for a fire. For an opioid overdose, let's all remember lay, spray, and stay. We'll demonstrate how to use it shortly. I want to acknowledge our community behavioral health team, our superstar team who went from door to door to local businesses and reached out to community organizations and libraries throughout suburban Cook County to host boxes in their spaces. I also want to thank the 30-plus businesses and organizations, including Jessica Rodriguez, director of the Steger South Chicago Heights Public Library, the Wayback Inn, including Chris Ward and Anita Pindier, the executive director, Salvation Army, Veronica Soto, Major Valeska Redon, and Major Heriberto Jara, for their partnership. Public health does not happen in a vacuum. It is always in partnership. Finally, I want to close with a few words about impact. This program saved lives. Since the inception in December 2020, CCDPH and partners have distributed 40,000 naloxone kits. 180 naloxone doses have been used to reverse overdoses. That's 180 lives saved, with the true number being very likely much higher, with many more lives saved by community members. We know of at least one life saved directly by naloxone administered that had been obtained in a naloxone box installed just last year. That is why this matters. Every naloxone kit represents a chance to save a life. Next up, my friend and colleague, Dr. Tom Nutter, the Chief Behavioral Health Officer at Cook County Health. Thank you.
Good afternoon once again, and thank you, President Preckwinkle. Thank you to the Cook County Board of Commissioners, particularly Commissioner Aguilar and Commissioner Anaya, who you heard from earlier. Thank you to the CCH Board of Directors and to CCH CEO Dr. Makaitis for their support of the vitally important work being described today. On behalf of the Office of Behavioral Health, I want to also thank our colleagues at the Cook County Department of Public Health, particularly Dr. Joshi and Ms. Kite, for their collaboration and persistence in expanding the availability of naloxone and other harm reduction interventions for Cook County residents. Thank you also to the CCH and CCDPH communications teams for all that you do and all that you will do in this Get Naloxone campaign. Naloxone is a critically important medication for the prevention of opioid overdose deaths. It is highly effective as an antidote when taken following an opioid overdose. It is a remarkably safe medication, safe enough to be available over the counter. And it's even an inexpensive medication so that it can be offered for free for anyone who needs it or anyone who knows anyone who needs it, which is most of us, the vast majority of us. Given that the opioid crisis is far from over and that we have such a powerful tool to save the lives of our friends, our neighbors, and our families, it is simply imperative that we spread the word about naloxone and strongly encourage widespread availability of this life-saving medication. That is why CCH ensures that naloxone is widely available in our clinics, why CCH's Office of Behavioral Health secured naloxone vending machines for Stroger, for Provident Hospital and the Core Center, why alongside our colleagues at CCDPH, we've placed naloxone vending machines at all Cook County courthouses, why our impact fund supports numerous community agencies doing opioid harm reduction programs. Thank you to Jennifer Brothers and her team for their outstanding work in that space. And it's why not only the CCDPH and OBH teams, but also the Chicago Department of Public Health, the state, and other governmental agencies are continuing to coordinate our efforts. But reducing opioid-related deaths isn't just the work of any governmental entity or intergovernmental or public-private partnership. It is about all of us. The Get Naloxone campaign is about making everyone aware so that all of us can do our part. While opioids have taken and continue to take far too many lives, often those drugs begin taking from those addicted to them long before then. Because addiction to opioids typically means having to obtain the drug daily to keep from being violently ill. Opioids rob people of their dignity, of their ability to work, of their ability to maintain important relationships, and even their sense of agency. To those impacted by opioid use disorder, the availability of naloxone sends a message that you are seen, that you are cared about, that there is hope, that there is treatment, and that importantly, you are not alone. And with that, it's my pleasure to introduce Elsie Salamanca, Community Impact Manager here at Corazon Community Services.
Good afternoon, everyone. My name is Elsie Salamanca. I'm the Community Impact Manager here at Corazon Community Services. And I would just like to say, as the heart of the community, we strive to help everyone in all possible manners. So thank you so much, Cook County Commissioners and Cook County Department of Public Health, for allowing us to use our mission to support this initiative. I've been asked to repeat some of Dr. Josie's remarks in Spanish, and I will do that now. Buenas tardes, mi nombre es Elsie Salamanca, soy la gerente de impacto comunitario de Corazon Community Services. Como el corazón de la comunidad, nos esforzamos para apoyar en todos los aspectos. Gracias al Condado de Cook y el Departamento de Salud Público para dejarlos usar nuestra misión para apoyar esta iniciativa. And I will repeat the comments. Ahora repetiré los comentarios del Dr. Joshi en español. Tener naloxone alcance puede significar la diferencia entre la vida y la muerte durante una sobredosis de opioides. La iniciativa de Get Naloxone está diseñada para facilitar que cualquier persona pueda obtener naloxone gratis sin necesidad de receta ni hacer preguntas. En los suburbios del condado de Cook, las muertes relacionadas con los opioides siguen representando un grave desafío de salud pública. La naloxone debería ser tan común en casas y negocios como los extintores de incendios o los botequines de primeros auxilios. Todos deberán tener y sentirse con la capacidad para usarlo cuando sea necesario. Todo el mundo conoce detente, tírate y rueda para un incendio. Para una sobredosis de opioides recordamos todos, acuesta, rocea y quédate. Acuesta a la persona, rocea el naloxone, quédase hasta que llegue la ayuda. En breve demostraremos cómo usarlo. A las más de 30 empresas y organizaciones que ahora cuentan con cajas de naloxone, gracias. Todos ustedes están haciendo un trabajo crítico de la salud pública, al proporcionar recursos que salvan vidas y rompen el estigma. Su compromiso hace que nuestras comunidades sean fuertes y seguras. Hoy también anunciamos el nuevo panel de datos sobre opioides con información sobre raza, etnia, sexo y género para muertes y visitas al hospital. Esto nos ayudaría a obtener mejor las intervenciones para las personas con mayor riesgo. Este programa salva vidas. Desde el diciembre del 2020, el Departamento de Salud Público del Condado de Cook y sus socios han en su mayoría distribuido 40,000 kits de naloxone. 180 de estos kits se utilizaron para revertir sobredosis, en su mayoría reportados por los cuerpos policiales. Es probable que ese número real sea aún mayor, con muchas más vidas salvadas por miembros de la comunidad. Sabemos de al menos una vida salvada directamente por una caja de naloxone instalada en el año pasado. Por eso este trabajo es muy importante. Cada kit de naloxone es una oportunidad para salvar una vida. A nuestros socios, organizaciones y defensores aquí presentes, gracias por ser promotores de la naloxone y defensores de la vida. Juntos podemos cambiar el rumbo de esta crisis. Thank you, and I will introduce now to Denise Holman, opioid health educator of Cook County Department of Public Health. Gracias a este momento voy a introducir a Denise Holman, una educadora de salud de opioides de parte del Cook County Department of Public Health, y va a hacer una demostración de cómo usar el naloxone.
Good afternoon, everyone. Good afternoon. Thank you all for coming out. My name is Denise Holman. I'm the opioid health educator with Cook County Department of Public Health, and I would be doing a quick demonstration to show you all how to recognize overdoses and how to respond to an overdose. Some of the signs that someone will have when they are suffering from an overdose, one of the things you will see with lighter skinned individuals, they will start to turn a bluish color, and darker skinned individuals will turn into an ashen kind of gray color. Another main thing that you will notice is if someone is suffering from an overdose, they are not going to be responsive. So if you're calling out their name, you're talking to them. You can also practice doing sternum rubs, which is like this, or going across the bridge of their nose. And if the person still has not responded, that's when we are going to do these simple steps to help save a life. So what we've been teaching everyone is lay, spray, stay. And pretty much when you're doing lay, spray, stay, the first part is lay. And you want to put the individual on the ground, but if it's hard for you to put that person on the ground, you want to be able to tilt their head back some, so you'll be able to administer naloxone. Next is the spray part. So you will put the kit in the nose like this. You will hit that plunger, and that is spray. Next, you will lay the person in a comfortable position. That way, in case that you have to walk off to call 911, open up the door for emergency services, or if you ever have to step away to do anything, you will put that person in the most comfortable position as possible. And also, sometimes naloxone does not work with the first dose. You want to wait 2 to 3 minutes before you administer another dose to the individual. And that way, you'll be able to save a life. Thank you, and have a good one.
Thank you. Thank you all for joining us. Do we have any questions?